Hello, Meredith. It is so good to see you.
You too, Susan. Thank you
Ah,
so much for inviting me here.
yes, and I really wanted to have you on this podcast because I'm talking this year about different ways of healing. And I know some of the work that you're doing is psycholytic ketamine groups and also psychedelic ketamine individually and maybe in groups. You'll have to tell me if that's happening now. But I wanted to start this conversation about just demystifying and giving this talk to be an opportunity for people to decide whether this is something that they want to explore. And just what we've seen in working with our clients and what we feel like is helpful and different ways that we recommend our clients using ketamine. So, welcome, and I can't wait to tap into your expertise.
Great. Happy to be here.
So what do you think about that? Like when you're trying to describe to somebody about using ketamine in terms of another tool that they can use in therapy, how do you describe it to them? Let's start there.
Yeah, and right off the bat, I love how you said a tool, right? Because I think in our culture, we think medicine of any kind, and it's like, take the pill fixes the symptom. Okay, we're good to go. Um, but ketamine really doesn't work like that. And that's one of the things that really inspired me. One of the things that inspired me to learn more about ketamine was that I was seeing the research coming out about ketamine's effectiveness with treatment resistant depression, right? This is like 4 or 5 years
Mhm.
ago.
Yeah.
Um, and then looking at kind of how it works in the brain. Uh, So traditionally, clients maybe they're taking antidepressants. They've been taking antidepressants for years, right? So
Mhm.
we know with antidepressants, they take the pill, it works, and then they don't take the pill and it doesn't work, or maybe it stops working or something like that. So the difference with ketamine, and I know this is kind of a big, wraparound way to get to answer your question, but the difference with ketamine is that you take the medicine, you have the experience, and then it's not just what happens in your brain from the medicine. Yes, that's part of it. It's also then what you do after with the experience and integration. And that's what makes it different from traditional antidepressants, number one. And number two, as such a powerful tool in therapy because it can kind of take rigid or very hardwired brain connections, so to speak, and give them maybe a little bit of softness, give the person a little bit of space so that they can start to actually think of things differently, which then can lead to different choices, behaviors, patterns, etc.
Mhm. Mhm. Yeah, so it's not only it's like if people could have an integration session after taking antidepressants, and that might be one of the ways to continually figure out like what is the symptom that they're trying to get rid of and how do they understand that impacting their life and maybe the resistant medication resistant depression when and a lot of medical facilities are using this like ketamine. What is it called? ESK or something like that.
Oh, like Spravato,
Yeah.
esketamine, yeah,
Yeah, S-ketamine.
nasal spray.
Right. So that's another way to use it is that you would go to the clinic and you would do this nasal spray and it's like a 15-minute thing. One of the things that I find with that is that if those patients don't have a place to integrate, they're still not getting the full effect of the medication because it is the integration piece and understanding how the new neural pathways are being developed so that you can actually have different experiences uh, within your depression or within whatever it is that's kind of blocking you or stopping you from living life. I'm just going to say on your own terms or however you foresee that or whatever is stopping you from feeling like you're free of whatever is holding you back mental health wise. Would you agree with how I said that? Yeah.
Yes, because so one thing that they've found with ketamine is that it enhances this window of neuroplasticity, like what you're talking about, which is basically neuroplasticity really refers to our brain's ability to change, right? Where we used to think maybe this person's this way and this is their brain and this is, how they're going to be. What we're learning more and more is that the brain changes and can continue to change over our lifetime. And then bring ketamine into the mix. So let's say, if we think of neuroplasticity, right? Like we have, this is not exactly what it is, right? Because the brain is so complex. We really don't know exactly anything. But if we can imagine like a pathway in the brain, right? And the pathway is the depression pathway. And this person has been going down this depression pathway for 40 years, right? So
Mhm.
that pathway is pretty well paved. And so they have a hard time getting off that depression pathway because it's so well paved. Everything else is, there's not a path in sight. And what ketamine does is it all of a sudden kind of creates a possibility for maybe a different perspective about the path, or maybe even a new path to emerge that then they start uh, adventuring on this new path. And so really what you do within that neuroplastic window, it's really important because that's the
Mhm.
time where you can start to
Mhm.
pave some of those new paths, or really cement in maybe even a different perspective about the old path.
Mhm.
It's not that literal, but that's the idea. So it's like, to make the most of a ketamine treatment, it really does matter what folks do in the neuroplastic window afterwards.
Right, right. Otherwise, it's just sort of, it can just go un, would you call it, guided? Like that you can guide the memory that's coming through and help that client understand some of what meaning they're giving that and what meaning they want to give it. So a lot of times if people have trauma that holds them back, that yeah, the trauma is the trauma memory, but the way that they move forward with that experience of having happened is what we're guiding them towards, like the forward motion, the next chapter, so to speak.
Right.
Mhm.
So I have a I since I started doing this work, I don't know why this is the metaphor that just came to me, but I've been using the metaphor of exfoliant. So if you have dry skin, let's say, and you buy all these great lotions and products, and you're putting them on your skin, but like, okay, it's not working great. And then you get a great exfoliator, you get all the dead skin off, and then your products can work even better. So I think of CAP as like the exfoliant.
Mhm.
So then, that the therapy can work better, but it kind of allows for deeper processing because maybe you got rid of some of that dead skin that was a barrier before.
Right, right. I always think about it. Recently, I've been probably in the last few of my podcasts, I've been saying the same thing, but I've been reading the Power of Now, just rereading that book from Eckhart Tolle, and he talks about this idea that when there is traumatic events in your life or depression or whatever it is that is holding you back, that a lot of times we live 90% of the time in that experience. And that, I always think about ketamine as is kind of helping people get to be more present in their life. And that means that possibly 10% of what used to be the 90% might still be around, but it's manageable.
Mm,
It's a manageable piece. Um, it's not in the 90%. And almost like I always think about the work people do in the alternative realms, like whether it's EMDR or EFT or ketamine, that they're pulling themselves into a way of using different tools to get more understanding about what's going on with them, but also what to do with it, how to integrate it. And that's why the integration sessions of whatever is discovered in the ketamine session is so important because you have to figure out what you're going to do with what you discovered. Right? How does it make sense? So tell me, like when you're, because I know we've talked about, and I met you through learning about the psycholytic version, which is the lower dose version of using ketamine versus the higher dose version of the psychedelic level of using ketamine. Can you describe the two differences and how you would describe? I always like you to describe it to like how you would describe it to a client, and how would you encourage them to do one or the other if you felt like they were wanting one or the other.
Yeah, and it's interesting because we're learning so much as this field is evolving, and I think probably my answer, a year and a half ago would be different than it is today.
Mm.
But there are benefit to there's benefits to high dose and low dose work. And in so many different ways and layers. But maybe I can talk a little bit about how I got to offering psycholytic, because I think that that could be helpful. Just like uh my journey as a client has paralleled my journey as a therapist in a lot of ways, especially since coming into this space. Um, but when I first started offering CAP in my practice, people weren't really talking about psycholytic low dose work. Most of the research at the time had been from IV clinics. It was a very high dose, high
So
intensity
with IB, so people understand.
intravenous.
Okay.
So you'd go to a clinic and an IV would be put in your arm, and you would have 45-minute ketamine drip, basically, through an IV. And that creates a psychedelic dissociative experience. It's not a traditional psychedelic, but people have psychedelic experiences with ketamine. It's actually a dissociative anesthetic. And so at this very, very high dose, integration can happen a day or two later. Usually the experience itself, it's very intense. There's a lot of recovery time afterwards. You probably like the rest of the day, you're like out for the
Mhm.
count.
Mhm.
That's actually how I was introduced to ketamine assisted therapy, or actually, it was not assisted therapy, it was just the ketamine IV clinic. I was personally going through a tough time, and I saw this alternative treatment. I saw the research coming out about its effectiveness,
Mhm.
3 weeks, 2 sessions a week, 6 sessions, and you're cured, right? And something like that was kind of how it was
Yeah.
laid
You'll
out
be in a
there,
better spot. Yeah.
right?
Yeah. Uh-huh.
Well, so at the time, the place that I went to for this treatment, they weren't talking about integration or therapy with it. So it was like get pumped with ketamine and then go on your way, and like this is trauma treatment. And I was honestly like, it was very powerful. And luckily I had my own therapist and had done my own work, but it was really terrifying, that experience. And to have no mental health professional in the building, in no one holding that space and not knowing what to do with that afterwards, like you're talking about why integration is so important.
Mhm.
I just couldn't believe that this was a practice that was happening. um, but the research that was coming out about clients who were actively suicidal, treatment resistant depression, right? You can't like that. It's super powerful. And I'm also like, I hear someone screaming in the room next to me, and like, what if they don't have a therapist? So now I'm like thinking about them. So anyway, I kind of went on this mission to get trained in psychedelic assisted therapy integration. My training included ketamine assisted therapy. And yeah, and then I went back to the clinics, and I was kind of like, you need integration. And I'm probably like blacklisted at a local clinic, but whatever, it's fine. It doesn't matter. I put integration pamphlets in the waiting room. So I feel like
Yeah,
I did
yeah,
my duty, my due
yeah.
diligence.
It's true. It's so true. It's so true. It's like that. I think there is that thought of you just have the ketamine and it's going to bring you into your place that of recovery, but it is a form of therapy and it needs to be therapeutically used, and that means having a way of um, doing something with the experience, not just like getting the IV drip and then going home, or getting the nasal 15-minute. And it really is about talking through whatever it is that's bothering you, whatever it is that's upsetting you or brought you there to that point of needing to work with it. And so then when you're talking to clients and you're trying to figure out, all right, how, what are people asking for and how would you advise them?
Yeah. So then I really wanted to be able to offer ketamine assisted therapy in my practice as a therapist.
Mhm.
So I started reaching out to some prescribers, found prescribers that I could work with. And so again, at the time, all the research had been on, really high acuity. So we were looking at, clients that I was working with who their symptoms were so severe, they were feeling so stuck. I do brain spotting in my practice also. So I'm working with clients with trauma and
You
it's,
have to describe acuity and brain trauma so
yes,
people can
sorry.
understand.
Yes, yes, yes. So working with clients that usually have a pretty extensive trauma history. Complex trauma is when they call them little t traumas, which I'm always like, oh, I don't know how I feel about that. But little t traumas that happen over a lifetime that kind of like builds up versus PTSD, which is like a one event traumatic event. So the population I work with mostly are folks who experience complex PTSD. And so maybe we get to a place in our work together where they're feeling stuck. They feel like they can't get to like that next place.
Uh,
So that is when I would bring CAP, ketamine assisted psychotherapy, into the conversation and as a potential option, because I'm not like a pusher or like this is what you should do, prescribey kind of necessarily. It's like, well, here's this option, and I'm recently trained in it, and I'm just starting to introduce this in my practice. So that's kind of how it started.
mhm.
And I was able to partner with prescribers who supported ketamine assisted therapy, where like the person has to have a therapist. And
Right.
I started doing this higher dose work, not as high dose as the IV that they do in a clinic,
Mhm.
but higher doses that can be prescribed sublingual, right? So an oral version of ketamine that they can actually take in the therapy session.
Yeah. So, and that way, like, so it's a higher, like, almost dissociative experience where they're in the ketamine experience longer than the psycholytic, which is shorter. And so, and it would be because they've been experiencing this stuckness in this blocked place. And do you feel like you start them off with the lower dose just to get them to experience it and then go into the higher dose, or you just, how would you make that? How would you help them make that decision?
Yeah, that's a great question. Sorry, and to get back to even what psycholytic is, I so it, at the higher dose, right? Maybe you do that 3 to 6. It's like an intensive, but not everybody needs an intensive, and or um some clients go through the intensive treatment and then 6 months later, maybe they are feeling like, oh, I could use a little booster, or they want something ongoing, but they don't have the availability or the capacity to block out, 3 entire weeks. So there's a lot of different factors to take into consideration, right? At high dose ketamine, you're talking at least one preparation session, which is the session that you'd have before the actual medicine session. The
Hmm.
medicine session itself, which could be 2 to 3 hours, where the client takes the medicine, and then integration, which is a separate day, an hour. So you're talking about like a lot of time, a lot of money, like there's a big investment. And then you also need a lot of support around you because if you have kids, someone's going to have to take care of your kids later at these very high doses. So working with clients who maybe like could really benefit from ketamine assisted therapy, but didn't have it wasn't accessible at this high dose experience.
Hmm.
I started to become really curious about the lower dose psycholytic. And so psycholytic, there's no set range of dosing. It's just right lower dose. Um, but and there's also a wide range of experiences with low dose. So nowadays I am starting. I'm usually saying that I support mostly psycholytic low dose experiences because I've just found that it's so powerful. Honestly, it's kind of fitting with this feeling that I'm having lately of things needing to feel for folks like a little bit slower and more gentle.
Hmm.
So right in like kind of this culture that says like more is better and like you want this intense experience, like this is gonna be life changing, right? Like you need
Right,
that burning bush moment to heal.
right, right.
Um, I'm I've been noticing how actually what I've been needing, and as I've been sharing this, I'm noticing that my clients and colleagues and a lot of people seem to be resonating with this feeling that like I need to strip away some of that intensity. Like maybe in this chapter, I need something a little more gentle. Um,
Mm.
I have to get back to my life later
Yes,
today.
I want to really talk about that because there is that thought of introducing a client to ketamine and then also just seeing how they like that experience in their body, like whether they like it or whether they can tolerate it and get used to it. So I always find like when I think about my clients being stuck, it's almost like that we're talking about the same thing over and over again, but we're not getting through how to look at that differently, deal with that differently, and it's continue to be something that's causing frustration or annoyance to that client, or they're basically just talking about the simple frustrations of life, not their deeper material, and which is fine to do. All of it's fine, but a lot of people really want to continue that deeper level of work. So when you it's more than just a conversation that you might have with a friend if you're visiting, if you're meeting up with your therapist, you want to have a deeper conversation. And so sometimes people just don't know how to get into the deeper material week after week. And I find if people do something like every 3 weeks, every month, that deeper material stays more present for them. And I agree with you on this, the softness of it is that then it becomes more palpable to look at, and then to look at another aspect of it, and then continue to go back and forth into like what's comfortable about that experience now if there's been a few visits. And maybe the brain is so powerful anyways, it just takes that part of the brain, whether it's the ego or whether it's the executive parts of our brain that like are always planning and always it's got that list going of what we have to do, that it just gets a break. And I find one of the biggest things I hear from my clients is like, wow, if I lived without anxiety, that would be so amazing. And they get to feel what it feels like to have that anxiety lifted. Um, and then the goal is to like to really work on developing more skills to lift the anxiety on their own, right? Or to keep it lifted off, you know? And that could be depression and that could be whatever else. lack of motivation or procrastination, whatever it is that is the way that you're getting stopped in your life. But then I also agree with you around the bigger doses have a lot of recovery time. So maybe the busyness of like, yes, let's just do it. Let's just like take that boot camp. Like let's get in, in shape mentally and physically, let's do it. It is a maybe a whole day of sacrifice of your day, which is not a bad thing to do once in a while
Right.
to get to know yourself better in a deeper way. But it does require a real break in life to be able to do that.
Yeah.
Where this is something that I feel like a lot of people get used to I always do it in a 90-minute process, and then they might take a break and come back and integrate with me, but they go through it in a 90-minute process, right? And then they're able to like go out, finish their day up, They might have their chaperone standing by, which is someone that would be in the physical vicinity. But then they're able to like, make dinner for their kids and, take their back to their regular life and not like, okay, I'm going to be kind of under the weather, so to speak, for a day. Hmm.
Yeah. And again, right, like there are people who might have a different experience, and that's also part of the reason why I started offering experiential groups, because some folks find that even at a very low dose, they're having a full psychedelic experience. So the brain, right, it's so there's
Hmm.
four quadrillion connections, something like
Yeah.
we can't the I what I have learned is lean into uncertainty with all this,
Mhm.
right? Because we don't know what's going on in our client's brain.
Yes, exactly.
Oh my goodness,
Mhm.
it's so powerful. But yeah, for the most part, right? Like people can get back to their day. So you were describing something before that I think is really important here. So when we're chit-chatting, right, or we're talking to a friend, or even when we come to talk therapy and we're talking to our therapist, you see that top layer of the brain. So the red, the pink, the blue, like the purple, that whole top layer of the brain.
Yes.
That's that's the part of our brain that loves to talk about things. It wants to analyze, rationalize, ask questions, all that, right? And it feels good. There is catharsis to talking about stuff. I'd say like that's the most evolved part of the brain, right? It's
Mhm.
the part that makes us complex as humans, that we think, we analyze, we rationalize, you know, all those things.
Mhm.
So the thing is that the felt sense of an experience, right? So we kind of started talking about that, like that deeper, maybe it's like the sensation in the body, or numbness, right? Lack of the connection with sensation. What happens with significant experiences, the sensory information is stored in the deeper layers of the brain, the subcortical layers, those layers underneath that top cortical layer. And
Mhm.
that there's no language there. So a lot of times when we try to talk through our experiences and it feels like we're not getting anywhere,
Mhm.
it's because like, oh, we really haven't accessed that the deeper layers of what's stuck. It's not, really stuck, but um where there is no language, we can access that and process that really only through somatic felt sense experience. And so ketamine is one way that we can get there, and a lot of times in ketamine experiences, things will show up, not, it won't be such like a clear story, but it might show up in symbols, imagery, archetypes, or maybe just feels like there's a little bit of space from the material. And so that's why also introducing some kind of brain body work, or something that the client can use to start to process at a more sensory or somatic brain body level, and then bring it back up and talk about it during integration. That's the whole thing, right? Because then, okay, we still want to make sense of it and learn how to carry it out in our daily life, And so it's kind of like we got to kind of touch those deeper layers and then come back out.
Right, right. It's interesting because I'm doing the psycholytic groups too, and some of the things that I think are really powerful about those are, firstly, everyone in the group is trying to heal, and they're really, and that power of people trying to heal together
Absolutely.
is something, an incredible thing to experience. I also do them virtually like you do. I think you do them virtually, right? Mostly. And
Mostly.
and that even though it might feel like that's a tough thing to do, but people really need to be in the same space. Of course, that being in the same space is always a plus. But in this way, I feel like there is that connection that people are making. And when I'm noticing too is like whether it's there's other factors that help bring you into the experience, right? And some of that is like when you first show up, you actually, as a clinician, you try to help people get into the experience of the altered state with breath work, with guided imagery, with meditation. And then that really sets the frame of people being able to really gently go into a space that feels safe to go into. I always find, right?
Yeah.
And then there's that safety in the group of, and mainly when I'm watching everybody on screen, I'm just watching to make sure that they're all there and having their experiences. And of course, if they have their chaperone and anything happens, which mainly the main thing I notice, I don't know if you've noticed, but the main thing is people's computer unplugging and they just can't figure out how to replug it at that in their altered state.
Right.
But also the connection, I've heard things like, oh, I really never knew because I was able to do that. What you're saying is that nonverbal stuff. I was never able to understand the breath work. But then when they're able to do it in that altered state, they really understand what it means to change the energy in their body with their breath, or to feel grounded, or um, to relax and to just allow yourself to have an experience, to choose the thoughts you want to choose and not to have the thoughts choose you, kind of thing. Like the amount of ability that they have to control where their brain goes is also starts showing up as a nonverbal, really. Oh, I can see that I can do that. Like I can feel that I can do that actually. And I think that's one of the things you're talking about is then that's powerful because it allows people to bring that felt sense out into the world, out of their experience of the ketamine experience, because they remember what it felt like in their body. And so much of the feelings in your body are nonverbal unless you are in an integration session and actually verbalizing them, right?
Yeah.
So yeah, it does make sense. And so I always tell people this is not a recreational experience. And so this is not what this is for, This is really for, it's another tool to get to know yourself, to really go into a deeper process with yourself. Mhm.
Yeah.
Would you, the other part that I think people get stuck in, and maybe you think this is also a place, so let's talk about it if it is the idea of like where you get the ketamine and where, and the medication assessment and what that's like.
Yeah. So the medication part is prescribed by a prescriber, right? So you would meet with a prescriber and have a full evaluation, just like with any other doctor you see for the first time. And they will talk to you about any contraindications, which with ketamine, there aren't too many, but there are a few. They'll talk to you about, what medications you're on, your symptoms, the whole
Mhm.
assessment you would think you would have during an intake process. And then us as the clinicians, we collaborate, hopefully, with with the prescriber, where we get to share a treatment plan and kind of see what the dose is that the prescriber is recommending, and then be able to work with the client based on whatever their parameters were given by their prescriber.
Yeah. And and then there's timing. I have often find that I really support clients through that process because it's kind of it takes a while. I always personally try to get to know all the organizations that I refer to because I really want to know how they work and what their downfalls are. If they're, hard to, if the shipping is late or if it's hard to get appointments in with them because some people are really um, booked up, right? With
Sure.
serving clients. So, and just so I get a flavor of how to help someone manage that period that they're trying to get the medications, or even when they continue to do the ketamine treatment, getting it again. And it means you have to have something you're working on. You can't just be like, oh, I'm just curious. There needs to be something that you're working on to get the medication.
Right. So you would have to have a diagnosis code that the prescriber would evaluate and determine. Some prescribers will collaborate with a therapist and, to figure that piece out. And it really, because it's not like that new anymore, but the regulations around it are still kind of wonky. Um, different prescribers approach this very differently. So I've been trying to put together like a working list of private local prescribers in different areas that do specifically low dose because um, you know, sometimes it's harder to find for some reason prescribers for lower dose, I found. But then there are like some larger companies
Right.
that have prescribers in, almost every state in the US. And so there's different ways to approach that. And I think that the time frame, I try to schedule it so that, having in mind that it might take a little bit for them to get the medication, to have at least one or two preparation sessions in that time. And so maybe in the preparation sessions, maybe one of those will be more focused on logistics, like what the medicine sessions will actually look like, getting prepared for that. And the other preparation sessions will be focused on whatever kind of work we're diving into or whatever the
Right.
client's focusing on.
hmm Yeah, and then it's the 48-hour neuroplasticity framework that happens after you do the session to be able to do the integration work, right? 48 to 72 hours. I always
Yeah,
think
that's
like 24 to 48 is ideal.
yeah.
Yeah, yeah. So, um, I wonder if there's any other things that you want to say about the ketamine work that you've done that you feel like is worthwhile for people who are listening to hear.
Yeah, I think that I really, really believe there's no one size fits all treatment. And so same goes with ketamine treatment, right? It's not for everybody, and that's okay, but it is a tool, an option that's out there for folks.
hmm
And there's a lot of talk and hype around psychedelic assisted therapies in general right now.
Right, right.
And one thing that I've been noticing is that ketamine can be a lot more accessible. Number one, because of what we talked about, where it's like the less recovery time, especially at lower doses, but also, for clients that do take antidepressants, SSRIs, SNRIs, and don't want to get off them or feel like they can't get off of them, whatever the case is, ketamine is like one of the very few, I mean, maybe I'm not going to say only because I'm not sure, um, medicines that we work with in this capacity that doesn't have a contraindication with SSRIs or SNRIs.
hmm
So that can be really hopeful to someone who's like, oh, like really wanting to do some kind of psychedelic work, but they would have to get off of their SSRI. Well, with ketamine, you don't. So that makes it a lot more accessible in that way too. So I think that it's a great tool as long as you have this support of a therapist, the setting, like get set up the right way,
Right,
and it's a tool, right? Like you said.
right, right. And then just explain a little bit about brain spotting and what you meant by that. The
Yes.
integration tool.
Yeah. So I am a brain spotting consultant. I've been doing brain spotting in my practice probably oh yeah, since the pandemic, so about 6 years. And so brain spotting was adapted from EMDR by Dr. David Gran.
Hmm.
He was an EMDR therapist and he was working with a figure skater and she couldn't land this I'm blanking on what the exact
Yeah.
thing it was basically. So they were doing EMDR, and then as she was tracking his fingers, he noticed that her eyes started wobbling at a certain spot. And so instead of continuing to do the bilateral movement, he had her stay at that spot. And as she kept her gaze at that spot, she started processing all this material that hadn't even come up in like their years of working together. So that was kind of the birth of brain spotting, that where you look affects how you feel because the eyes are directly connected to the brain. It's kind of our most direct access to that subcortical brain, those
Hmm.
deeper layers of the brain. And it's another kind of therapy where you actually don't have to talk about it. It's very much tuned into felt sense and noticing and
Yeah.
curiosity. So it's a really interesting, really different way of working in therapy, maybe than what folks are used to in traditional talk therapy.
Right, right. So that, again, like there's might be different ways that your therapist is helping you integrate whatever
Cool.
their form of therapy is, or maybe it's not the usual form of therapy that you do with your therapist, but it's to keep that how do you call it? The
Subcortical.
subcortical level activated so that you're working with that level when you're speaking with your therapist, when you're doing your integration work.
Yeah, so that
Mhm.
right, integration can be done. There's no one way to do integration either, like you're saying, right? I do
Mhm.
brain spotting. That's also not for everybody. Some people do want to be able to just talk, and there's nothing wrong with that either.
Right.
This isn't
Mhm.
like right or wrong or better or worse.
Right. Sometimes people are making their own connections, but they do
Yeah,
need to be like held in a container to do that.
that's
Again,
it.
so it's that higher level of work that's always being done. Well,
Right.
I think that I really like the work that you're doing, so thank you for sharing it with me in
Thank
your
you.
newsletter, and people will have access to you, so be able to find out how to reach you and how to read about you and what you're doing and how you think from month to month in your newsletter. But I do think there is something to be said about going and exploring different forms of therapy if you feel like you've been stuck in a place or you feel like you're just not getting into your deeper material, and that's the whole reason why you're working on yourself is to do that. I think it's one of the tools that is worth exploring or at least checking out to see if it would be a fit for clients here listening or people here listening. So
Definitely.
thank you so much for helping me expand some of the information about ketamine and psycholytic work. And I just think it's invaluable.
Yeah.
Yeah.
Thank you so much. It's
Yeah.
been
You're
great
well,
chatting with
well,
you.
thank you. It was really great to talk to you. And I hope to see you soon.
Definitely.
Okay.
All right. Take care.